Hi guys, this is Corey Dougherty, and here is my presentation on ALS. Um, so, ALS is commonly referred to as Lou Gehrig's disease. It stands for amyotrophic lateral sclerosis, and it is a progressive neurodegenerative disease that affects the nerve cells in the brain and in the spinal cord. Amyotrophic comes from the Greek language, a meaning no or not, myo refers to the muscles, and trophic relates to the nourishment that the muscles are getting. So amyotrophic means no muscle nourishment, and when muscles have no nourishment, they tend to atrophy or waste away. The L in ALS is lateral, and that just kind of identifies the area in the person's spinal cord where the portion of the nerve cells that signal and control the muscles are located. And as those areas degenerate, it leads to scarring or hardening, and that's called sclerosis, and that's where the S comes from. So the symptoms that come with ALS, the motor neurons withering away causes the loss of voluntary muscle action and leads to the losing the ability to speak, eat, and move. The degeneration of the muscles kind of brings on a constant soreness and stiffness that makes most muscle movement, including breathing, uncomfortable and painful. Unfortunately, ALS is currently a fatal disease. There's no known cures, and the progression eventually affects all muscle function, causing the affected to lose the ability to eat, swallow, and eventually breathe. The diagnostic criteria for ALS can be a little complicated and time-consuming, as the most common way to be diagnosed is through a series of tests, kind of ruling out the other diseases. These tests can involve EMGs, nerve conduction studies, MRIs, blood and urine tests, as well as muscle biopsies. I included the pictures. So Lou Gehrig here on the right is kind of the namesake of the disease. It's commonly referred to as Lou Gehrig's disease. And then on the left here is Dr. Stephen Hawking, who I think most of us kind of see him in his wheelchair with the robotic voice, but this is actually when he was 21 years old, and he had been diagnosed 2 years prior. So he's 2 years into the disease and obviously lived the vast majority of his life with the disease. So for the causes, there's no known cause for the disease currently, but research suggests that it is through a combination of genetic and environmental factors. Researchers also suggest that there is a correlation between smoking as well as military service. And because there's no known causes, it's kind of difficult to say what kind of risk prevention you can do to kind of avoid getting this disease. So aside from living a healthy lifestyle, there's no real way to set yourself up in a better chance to not get it. Here's a little chart that is done through a study by Emory College. And so here you can just kind of see that the prevalence, it generally just slightly higher affects men than women. Also, it is generally diagnosed between the ages of 55 and 60. There isn't a whole lot of consensus in the medical field about which drugs are the most effective when treating ALS. A couple of the most common are Rilitec and Radicava. I think I'm saying those right. But they also come with a really long list of side effects, such as migraines, nausea, stomach pain, loss of appetite, muscle stiffness, constipation, just, kind of getting a little and getting a lot with that. It's also really common for people diagnosed with ALS to be prescribed with physical therapy as well as aquatherapy. The physical therapy can kind of help reduce the decline in muscles endurance as well as flexibility and balance. And then aquatherapy has kind of just come about recently in the field. It kind of helps reduce a lot of the pressure and the pain in the joints that they might be feeling due to the disease. So ALS destroys the motor neurons in the brain, um, which eventually leads to the muscle atrophy and the loss of voluntary muscle movement, um, to the point where it just becomes uncomfortable and painful and eventually impossible to do functional movements, putting your hands above your head, taking a seat in the chair. And then due to the loss in the muscle strength and endurance, even short bouts of exercise can lead to extreme fatigue. Um, Exercise is often prescribed to the patients soon after the diagnosis. It can help reduce the pain that they're feeling, the atrophy of the muscles. It can kind of slow that down a little bit so that they can maintain some sort of functionality and individuality as they age and as the disease ages with them. Yeah, so it can kind of help with keeping strong so that you can keep your balance. So you're not a fall risk, but it's a losing battle. Unfortunately, exercise can only help so much where the disease ultimately ends up winning. So for my case study, I chose to do a 62-year-old male with no family history of the disease. Normal vitals, resting blood pressure was 124/78, resting heart rate was 74. And after submaximal testing, we decided that his max heart rate was 155. Slightly obese, not very much, but just barely. Currently taking the Radicava IV. So they got that shot during the diagnosis, and they were diagnosed with the ALS 3 months ago and were prescribed exercise to reduce the muscle degeneration. For the exercise testing, I decided to do an aerobic test. I could do the Astran test, where we'll have the patient on the bike for 7 minutes doing a submaximal test to see where their aerobic fitness is at. For muscular strength, I decided to do a 10 RM leg press test. I don't really think that doing a 1 rep max or even a 3 or a 5 would be very effective or give us kind of a good idea of what we're working with. So I opted for the 10 rep. And for the endurance test, I decided that a 1 minute squat test, just body weight squats, would be the best to test that. And then as far as the balance, I wanted to do 2 separate ones. I decided the Romberg test would be the best. We can kind of get a little tricky with that, throwing in foam or having eyes closed. So just add some variability in there to kind of see where we're at with the balance. And then for the static balance. And then for the dynamic balance, I want to work on a tandem walking test. So I want to have like a 20 feet tandem walking test, and we'll do that a couple of times just to see where the dynamic balance is. And then as far as flexibility, for the upper body, I chose to do Apley's back scratch test, and for the lower body and the back, I chose to do the sit and reach test. So after we get all the testing done and we decide to start the exercise program, so I want to start with a warm-up, like a 10-minute ride on a recumbent bike with a little resistance, something that they would probably rate in the 9 to 10 range on the Borg scale. It can also help with the warm-ups and the aerobics. And then we'll move the patient into the pool to do some aqua therapy, to either swim some laps in the pool or walk some laps in the pool, just to do some like low impact exercises to kind of help ease the joints into the exercising for the day. And then we'll remain in the pool to move on to the resistance training. We could do a lot of body weight exercises in the pool, like squats, different kinds of low weight exercises to get the upper body moving. And then once we're done in the pool, we'll have them move out of the pool and do some machine exercises, like the leg press, knee flexion extension machines, shoulder and chest press, just working on muscular strength there. And then we could do some like resistance bands if they are getting a little too fatigued to participate in the machines. As far as the flexibility training goes, we include a lot of the lower body stretching, hamstrings, calves, quads, adductor ITB, a lot of lower lumbar back stretching as well as some upper body stretching. What I really wanted to focus on was the balance activities. We would do a lot of dynamic balance work because that's a huge risk when we're dealing with the patients that are losing the muscle energy to complete a lot of these tasks. So, I do dynamic balance work, like the tandem walking that I said in the testing, maybe doing a Romberg with a little bit of a ball toss to kind of test and see how they work, trying to move and regain the equilibrium. I would also have them doing like a 4-square stepping test and figure eights. And the cool down, I would recommend just doing like a 5-minute walk on a treadmill, again, to practice their gait and their balance. Special modifications, like I said, with the weakness in the legs, it is important to have a close guard assist throughout all of the standing exercises. And then even the balance stuff, I would even recommend having a gait belt on the patient. And then as the disease progresses and we get further into the routine, have the gait belt on a little bit more, and then doing what we can with the balance. It'll also be pretty prevalent to keep an eye on the patient's fatigue levels and their energy levels throughout the program, because like I mentioned earlier, fatigue is a big problem with ALS patients. And here is my sources. But I also think it's important to mention that while there is no cure for ALS, the effects of the exercise and a good diet and nutrition can help the patient maintain some autonomy and pride as the disease slowly takes that away from them. So thank you for watching. I hope you learned something. And if you have any questions, feel free to leave a comment. Thank you.